watching NBC4, connected to you. Live from the area's leading news station, this is News 4 at 11.
And we'll report on why it's easier to get a Botox appointment than an appointment to check out potential skin cancer.
More and more dermatologists are offering cosmetic services alongside traditional medical dermatology. But some worry that doctors are putting those cosmetic treatments ahead of treating possible life-threatening conditions like skin cancer.
Yeah, hi. I have a suspicious-looking mole that doesn't quite look right. When is the soonest available?
You call the dermatologist's office to ask about a mole that might be cancer, and you'd think they'd want to see you soon.
The beginning of May. Really, in 2 months.
News 4 surveyed local dermatologists, and we found that getting in to see the doctor might take a while, especially compared to booking an appointment for a Botox treatment to smooth out some wrinkles. News 4 called 40 doctors' offices, and we found that, on average, the wait for a Botox appointment was 5 days. For a mole check, more than twice as long, about 12 days. But that was the average.
Doctor's office,
One receptionist said it would take 36 days to get a mole checked out, but only 4 for a Botox treatment.
The question might be, well, why would you have incentive to squeeze in such a patient? And the facts are that that's a cosmetic cash paying procedure.
Some doctors will tell you that dermatologists need to do more cosmetic procedures to pay for the rising costs of things like malpractice insurance and new technology. At the same time, they're getting smaller reimbursements for medical procedures from the health insurance companies. Georgetown University Hospital dermatologist Dr. Paula Borelli was not part of our survey, but she agrees that there are some problems with the system.
What that office stands to earn for a Botox patient might be 2, 3, even 4 times what they would get for a regular general medical derm patient, particularly if you have to rely on insurance.
Do doctors remember the oath that they took before they started practicing medicine? Don't they need to put that oath first before the dollar?
The emergency is the mole, not the Botox.
While some in Washington say they're appalled, the problem is probably nationwide. One California university called dermatologists in 12 different cities across the country. Typical wait time they found, 8 days for Botox and 26 for a mole evaluation. American Academy of Dermatology board member Dr. Sandra Reed says the national study isn't significant.
It does not represent the practice of dermatology across America. It's a very limited study in a very limited situation.
But when News 4 called Dr. Reed's office, the receptionist said there's a 2-day wait for a Botox appointment. For the mole check, 21 days.
I'm surprised, and I'm definitely going to look into it, but we do not have that policy where people wait that long.
Reed added that in her office, a skin cancer check always takes longer than a Botox appointment, so they can be tougher to squeeze into her busy schedule. D.C. dermatologist Dr. Tina Ulster had the longest wait time for a mole check in the News 4 survey, 60 days. Just 7 days for a Botox appointment in her office.
If it's truly an emergency and a mole that has changed, most physicians will treat that very seriously and have that person come in as soon as possible.
All the doctors we talked with said it's important for patients to be very clear over the phone about an urgent situation. Use the word emergency if it is. Most physicians save time in their office schedules for urgent appointments. When it comes to skin cancers like melanoma, you can't afford to waste time. The sooner it's treated, the better chance for recovery. For more information about skin cancer and potentially cancerous moles, go to NBC4.com and click on Health.